My poor dog is having surgery today to remove cancer from her shoulder. She's an 11-year-old giant wishbone. She's been my constant companion as I work, eat, and sleep since we got her from a shelter about 5 years ago. Welcome to CognitionChunks. This information is for entertainment only. I am not medically trained. Is this useful? Is this nonsense? Join me as I attempt to learn from GPT. Here is understanding a grade 2 spindle cell carcinoma on the shoulder of a canine.
Spindle cell carcinoma in dogs is a type of cancer that is part of a broader group known as soft tissue sarcomas. These are malignant tumors that arise from the connective tissues of the body, which include fat, muscle, nerves, fibrous tissues, and the deeper layers of the skin. Spindle cell carcinoma specifically is characterized by the spindle-shaped cells that are seen when the tumor is examined under a microscope. The term spindle describes the elongated and somewhat pointed shape of these cells. Origin and development. Spindle cell carcinomas can originate from various types of connective tissues, which is why they are often grouped under the broader category of soft tissue sarcomas. They are called carcinomas because they tend to have a more aggressive behavior similar to that of epithelial cancers, despite arising from mesenchymal, connective tissue, cells. Clinical features. On the shoulder of a dog, a spindle cell carcinoma may initially present as a seemingly harmless lump or bump. These tumors can vary significantly in appearance, ranging from soft and fleshy to firm and immovable. They are often mistaken for benign growths or simple injuries at first. As the tumor progresses, it may become more defined and possibly ulcerate, leading to more noticeable symptoms and discomfort for the dog. Diagnosis. Diagnosis of spindle cell carcinoma typically involves a combination of physical examination, imaging studies, like X-rays and ultrasounds to assess the extent of the tumor and possible spread, and most importantly, biopsy and histopathological examination. The biopsy involves taking a sample of the tumor tissue and examining it under a microscope. This allows the pathologist to identify the characteristic spindle-shaped cells and determine the tumor's aggressiveness. Treatment options. Treatment depends on the tumor size, location, and whether it has spread, metastasized. Common approaches include surgical removal. The primary treatment for localized spindle cell carcinoma is surgical excision with wide margins, meaning that the surgeon removes not only the tumor but also a substantial amount of surrounding tissue to ensure no cancerous cells are left behind. Radiation therapy. This may be used post-surgery, especially if the surgical margins are not clean, meaning some cancerous cells were left behind, or in cases where surgery is not entirely feasible. Chemotherapy. While not commonly used for localized spindle cell carcinomas, chemotherapy may be considered if there is evidence of metastasis or if the tumor cannot be completely removed surgically. Prognosis. The prognosis for spindle cell carcinoma largely depends on the tumor size, location, and whether it has been completely removed. Tumors that are small and fully excised tend to have a good prognosis, with many dogs living for years without recurrence. However, larger tumors, those in challenging locations, or tumors that have metastasized have a more guarded prognosis. Considerations and supportive care. Aside from the direct treatment of the tumor, supportive care plays a crucial role in maintaining the quality of life for dogs with spindle cell carcinoma. This may include pain management, wound care for ulcerated tumors, and monitoring for any signs of recurrence or spread. Regular follow-up visits with the veterinarian are essential for managing the condition effectively. Research and advances. Ongoing research into canine cancers, including spindle cell carcinomas, is focused on understanding the genetic and molecular bases of these tumors, which could lead to more targeted therapies. Studies on immunotherapy and novel chemotherapeutic agents are also promising areas that might offer more effective and less invasive treatment options in the future. In conclusion, spindle cell carcinoma in dogs is a serious condition that requires prompt veterinary attention. The comprehensive approach to diagnosis and treatment, combined with supportive care and regular monitoring, can significantly impact the prognosis and quality of life for affected dogs. Advances in veterinary oncology continue to improve the options available for managing this and other types of cancer in pets. Thank you for joining us for another Cognition Chunks. Please like and subscribe.